Hi, I'm Ian, I'm the doc. This is Gary, he's our physio. Just want to talk about the knee injuries today. And it's a very complicated joint, the biggest joint in the body, and you obviously need it for walking. So it's very protected. It's protected mainly by big ligament on the inside, a ligament on the outside, the kneecap and the big muscle up here, the quads muscle, which is the biggest muscle in the body, and the tendon of the patella, called the patella tendon, and it joins the kneecap down to your shin bone. I just wanted to mention the medial ligament first. Medial means on the inside, and this connects the thigh bone to the shin bone and can get strained. So you can imagine when this opens up like this, this ligament can get strained or even torn. The same thing can happen on the outside, and this is the lateral ligament. The tendon that connects the kneecap to the shin bone is a very specialised piece of equipment, and it's a really common thing to get injured, especially in people that jump a lot, and used to be called jumper's knee. The tendon itself can become degenerate in the middle and damaged in the middle, and it can be very, very difficult to sort out sometimes, and specialist type of intervention is needed then. The last thing to talk about is direct trauma. In other words, the knee to knee that you sometimes see on the pitch, and probably some of you have experienced on the pitch, can be very painful and cause quite a lot of swelling and even bleeding, and can be very difficult for the physio on the touchline, but I'm sure Gary will tell you about that.
Thanks, Doc. Yeah, as the doc says, obviously when you're going onto the field of play, again, you're led by the symptoms from the player, and the player will tell you where the pain is. And obviously if they point to the inside of the knee, you would suspect the medial ligament damage. If they point to the outside, lateral ligament. If they point to patella tendon, again, that's what you would suspect. From an examination point of view, again, as the doc showed you, you would often stress the ligament, inside or outside, and to see if there's any laxity there. One point you'd have to look for immediately is immediate swelling. If the knee swells straight away, you know there's damage inside the knee. Easy decision, they remove from the field of play, you seek medical attention. One of the commonest things around the knee is direct kicks. And as the doc said, you have a very large muscle above, you have the calf below and the hamstring behind. You can be kicked from any angle. They will bleed and they will swell as well. And again, if you have a swollen muscle, the function of the knee gets affected. You can't bend the knee fully, you have loss of power. Again, easy decision, they come off the field of play and you seek further medical attention. They're all the outer injuries or the soft tissue injuries that you'd see on a football pitch. There are other ones, internal, that we'll go on to later on. But the important thing is swelling, pain, symptoms from the player.